Wellness, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker, alongside the ever insightful
Ciara Owens. Thank you, Will.
And we are so glad you joined us for today's conversation. This is the show where we shine a light on what really matters, our health, our communities, and the people working behind the scenes to make both stronger. We are proud to be Nevada's #1 public health community program right here on the People Station 88.1. We've got some amazing guests lined up this morning. Got a couple folks on the line and someone in studio that you're going to absolutely enjoy. So without further ado, I want to just check in on my girl, Ciara. Good morning.
Good morning, Will. How you doing?
I'm doing good. It's good to see you.
It's always a pleasure. You bring so much joy, always bring so much color. We matching today, so I love it a little bit.
Well, I want you to welcome our first guests that are on the line with us.
Yeah, so y'all, I don't know if you knew, and this is really something that I learned preparing for this show. Nevada ranks 51st for mental health access and outcomes across the state of Nevada.
It's 50 states.
Because they're including Washington, D.C. as well. 51st. We are ranking last.
Y'all, we can do better.
Way better, especially because we have so many resources, so many great things that are coming, and just so many opportunities and organizations that are looking to pour into us. So, Will, I'm excited to dive in and listen to Miss Anna Bobb as well as Dr. Mason Turner as we dive in and talk about what it really means for mental health. Hello, Anna and Dr. Mason.
Hey there.
Hello, Ciara. Hello, Will. Thank you so much for having me on the show.
No, we appreciate you all so much. 51st is crazy. Can you talk to us about that real quick before we dive into Path Forward?
Well, yeah, I mean, there's a lot of room for improvement all around the country. So I would just start there. We do have a mental health crisis, and I think we all have to improve, and yet there are some bright spots, and so hopefully those are ones we can learn from. And some of them are right here in Las Vegas.
We love that. We always love when we sit there and talk about that. So tell us, what is Path Forward, Miss Anna?
Well, so Path Forward, we're a Washington, D.C. based advocacy group. Our whole focus is improving access to mental health care and substance use disorder.
That's so important because they go hand in hand.
Indeed, they are. They're often in the same. They often will have the same person will have both, and yet sometimes we treat them too much as separate things.
Yeah. Now, Dr. Turner, I wanted to turn to you for just a moment because this is Mental Health Awareness Month. And since these two do go hand in hand, could you just start us off? First of all, introduce yourself and tell us a little bit about you, but also just some practical tips and information on this topic would be great.
Great. Thank you so much. And my name is Mason Turner. I'm the Senior Medical Director for the Behavioral Health Clinical Program for Intermountain Health. And we call Las Vegas part of our home. And we really want to think about how we actually improve the healthcare and the behavioral health care of everyone who lives in Las Vegas and in Nevada and throughout the country as well. I think what's really important when we look at some of the mental health wellness tips and topics, we can see mental health as being this big, huge, complicated issue. And it is. But also we can do a lot just by educating ourselves about what mental health and wellness are and what we can do to actually improve our own mental health as we think about and reflect on that in the month of May.
I love that. What would you say is the single best thing someone could do to improve their mental health?
Oh, that's a really tough question. And I would say there are a lot of things people can do to improve their mental health. But I think at the top of that list needs to be stress management. How do you think about balancing all the various things in your life you need to work on and that you have obligations and commitments to? How do we balance that and actually think about how we manage our stress in a way that's productive with our wellness in mind?
That's so powerful.
That is powerful. Yeah. Definitely something that I'm leaning into today for sure. So, Miss Anna, what exactly is that collaborative care and how we love to see this model everywhere?
Well, we would start with the thought that if we can just change how we deliver mental health care, in the family doctor's office or in the primary care or the pediatrician's office, we could save 14,000 lives per year in this country from suicide. But that really only happens if every person from depression who has depression is getting access to this model that we call collaborative care. So, it's great to have Dr. Turner on the call because he is one of the pioneers of getting collaborative care started and getting scaled around the country. So it's really kind of an honor to be on the call with him. But mental health care can be delivered right at the family doctor office. We just put the mental health care right in there in the visit. This is a model that puts the patient right at the center of the care. It has the patient and the doctor and the psychiatrist working together in a team. And then the most, I think, maybe important person in that team is this new part of the team called the behavioral health care coordinator, who can be a social worker, but could also be someone with an associate's degree. But the real heart of it is that they work very, very closely with the patient, and they're the patient's helper, and they're the patient's guide, and the patient's kind of champion in their health care. So that behavioral health care coordinator helps the patient overcome all their barriers that they would have to otherwise getting mental health care, including things like scheduling, including, medication, sticking on their meds if they need them, and then also providing some like light problem solving and even, kind of like counseling to the patient, which sometimes is all the patient maybe needs really to overcome the mental health care challenges that they're facing.
Absolutely. So what I'm hearing is that you are bringing together the right people with the right plan and the right resources in order to really create equitable access to healthcare more generally, but mental health in particular.
Yes, absolutely. We like to say there is no health without mental health care.
Yes. Now, you've got a report that was actually just released rather recently. What were the findings of that report?
Well, we have a big new analysis. It was done by Milliman, and it's a snapshot of where collaborative care is happening and where it's not happening. We looked at 219 million Americans across all types of insurance, so it's pretty comprehensive. And I think, the report is basic. What we found is that there's some really good news, and like the good news is that we've seen 10-time growth in the last 5 years in collaborative care. We've seen that level of increase over the last 5 years. The bad news is that we are still reaching less than 1% of all the people who we think could benefit. And that's basically anyone who has a mild or moderate mental health condition we think could benefit from this model.
And just so that we're clear, kind of when we say mild or moderate health conditions, mental health conditions, what would be some examples?
Well, so mild and moderate depression or anxiety, or for a child maybe like ADHD. But I would ask Dr. Turner. He would be more of an expert on that. But those are the kinds of conditions that we would treat with this model.
Awesome. Well, I mean, you've given us a lot already, because to understand we're only reaching 1%, and this is 10 times better than it was. That means we really do have a lot of work left to do, and I'm really grateful for what you're doing with Path Forward. How do people find out more information about this coalition?
Well, we're on the web, and we're on social media, and we love kind of hearing from new people who really are interested in getting more people access to mental health care. So we would love to have y'all, anyone on your show reach out to us. And we're also really kind of excited, about, Nevada and about Las Vegas, because, we are so excited about your kind of performance, so to speak, on this report. I mean, Las Vegas particularly is such a bright spot that lights up our national map. It's not, in Las Vegas, in Nevada, there's less than 1,000 patients who are receiving collaborative care. That's what we found with our analysis. That said, almost, nearly all of them are in Las Vegas. So that's where we're having a lot of success. And, this care is reaching older people with disabilities. That's where we're seeing the most growth in Medicare. That's where but again, Dr. Turner can tell you a lot more about why that's happening, but we just feel that that's sort of something that needs to be celebrated and praised, and we're grateful for all of the good work that's happening right now. in Las Vegas around, getting people, access to quality mental health care.
Thank you so much, Miss Anna. Dr. Turner, tell us, why is this happening? Why is Las Vegas a bright spot, literally and figuratively, on the map?
That's right.
That's right. Well, I just wanted to say that the fact that we're 51st in the nation in terms of mental health access and outcomes and what have you, just means we have a chance to grow and innovate and be creative about how we meet that need. And we know from a lot of different information we have working in the field, as I have for about 25 years, we know that mental health care needs to change. How we deliver it, how we provide that care, how we access it has really got to change. And collaborative care is one of those bright spots about how we go about trying to change and really right-size the care to the person that's in front of us. One of our major strategic goals at Intermountain is to bring more care to more people who need behavioral health care specifically. And we know a lot of reasons for that actually have to do with lack of access to quality behavioral health care, but also our system is not very patient or consumer friendly either. So we want to think about how we build programs that people who are in Las Vegas for 2 or 3 months, doing some kind of work there temporarily can access care. People that are long-term residents can access care as well. Those that have called Las Vegas home for decades can also access care in an ongoing long-term fashion. But we need to meet people where they are, and we need to understand how we can deliver care to them and help them to realize their goals and to feel better.
I absolutely love that. Thank you so much for that, Dr. Turner. I had someone who experienced mental health desperately and needed help and couldn't get it. And I remember he looked at me, he said, "Ciara, watch this." And he calmly acted like we were going to walk out, and he flipped over the plant. And then all of a sudden, a psychiatrist came out to help him at the VA. And it was so heartbreaking. And that's when I really realized how much I wanted to dive into mental health support as much as I love education. So you mentioned earlier, Dr. Turner, that one of the greatest things that we can do to support mental health is really just manage our stress. So what are some things that we can do that are practical tips for us to really be able to do that stress management or really dive into mental wellness?
Yeah, I'll actually give you 2 really practical tips that I think have been helpful for me and others that are struggling with stress management. The first thing is you've always got to take a look at what's causing your stress to see where you can reduce or get rid of some of that stress. And usually you can find maybe 1 or 2 things that you can let go of or deprioritize or really put off for later if you can do those kinds of things. Typically, that's not a really fruitful exercise, but it's important that we do that. It's important that we look at how we can reduce our stress and the number of things that are causing it. When we've done that, we need to look at how we build activities into our day that help us just to take a brief pause. Whether it's a 10-minute meditation or a 5-minute meditation, walking around the block to actually enjoy what's outside, or whatever you can do to actually bring some kind of relief and relaxation to your day, even if it's 5 or 10 minutes, that's really going to help you get through that day and be a lot less stressed.
Those are great tips. I love a midday walk.
Yes.
And just to get a little sunshine, and we've got plenty of that in Las Vegas. So you've got some services with the Medicare Advantage plan here in Las Vegas. Just really quick, can you talk a little bit more about the integrated behavioral health care?
Absolutely. And I think, Intermountain has a very large Medicare Advantage population in all of Southern Nevada, actually, concentrated in Las Vegas. We've developed a program called the Mental Health Integration, which actually brings together a lot of the elements of collaborative care and integrated care delivery to those folks who are accessing our care throughout Las Vegas and Southern Nevada, really anchored in the primary care provider's office. We're expanding those programs throughout the rest of this year and into 2026. You're going to see more of our programs coming on board. And the idea really is to deliver the care where people need it in real time at the primary care provider's office and right-size that care to what works for them in their schedule and what they want to achieve in terms of goals. So again, we're really moving more towards that full collaborative care model, and you'll see more of that rolling out over the next 6 to 9 months.
That's exciting.
That it really is.
Yeah. Well, thank you so much for joining our program this morning, Dr. Turner. And I just want to give you kind of the last word in this segment. I'm excited about the path forward and the report that you've got coming out. But what would you leave with our listening audience?
Well, thank you so much for this opportunity, and it was so great to be with you. I just would, add that one of the things we love the most about this model is that it really helps people access care who otherwise struggle to access care. So we find, pregnant moms, and we find, marginalized particular populations, elderly people, people who face a lot of stigma, like, people who, like their families would be embarrassed that they would, be seeking mental health care. primary care overcomes a lot of those barriers because it really, by being at the primary care doc, you don't really, people don't necessarily know you're getting a mental health visit. They don't necessarily know that that's what's happening. And so collaborative care really overcomes some of the biggest access barriers. And then it provides this helper, this behavioral health coordinator who can actually, really be a guide and a help to the patient in continuing to overcome those barriers, even if it's something like struggling to schedule an appointment. And then lastly, because it actually uses the psychiatrist's time 8 times. It serves 8 times more patient because it's so clever with how it uses the psychiatrist's time, but it also manages to kind of do that in a telehealth way. So because of that, rural populations, even someone who is way out in the sticks and really can't get in to see the doc, they're able to get this care in a way that's really works for them. So that's really, I think, what we're really excited about as well, is its ability to help the people who really need it the most.
Well, we are excited about that, and someone must have slipped you a script or something, because you just helped us shift to our next guest, who's doing a little bit of a different kind of healing, but it's addressing many of the same things that you just shared. So thank you both for joining A Healthier Tomorrow, and now we'd like to welcome our next guest, Minjia.
Thank you so much for having me.
Hey, you are revitalizing Las Vegas's Chinatown district, which is more than just a location on a map. It's cultural, it's economic, it's a heartbeat of our community. So tell us a little bit about yourself and what you're doing here today.
Yes, hello everyone. My name is Minjia Yan. Minjia like ninja with an M, and I work in commercial real estate, and I'm the project consultant for Clark County's Chinatown redevelopment project, and my work also has involved in policy and regional planning that touches housing, transportation, and economic development in Southern Nevada.
What I love about this show, Will, and Minjia, thank you, is literally healthcare and wellness stretches across so many facets and sectors. I never would have thought about commercial real estate being a part of this, and it absolutely is.
Yes, because all of the things that we touch, we see, the buildings that we live and work in have an impact in our physical and mental health. And I can touch on how the Chinatown redevelopment project will bring the concept of building healthy community to the audience here in Las Vegas.
What does that look like? Tell us more about that.
Sure. Before we go into the details of the Chinatown redevelopment project, I want to start off by talking about the history of Chinatown here in Las Vegas.
Take us back
for us. Let's
talk about Las Vegas history. I grew up in Vegas. So back in the 80s and 90s, Las Vegas was booming with all of the big resort casinos opening up on the Las Vegas Strip. And there was a boom of tourism from California and all over the world to come to Las Vegas, including Chinese Americans and Asian American tourists. They came to Las Vegas in mid-1990s and they said, something is missing here in Las Vegas. Do you want to take a guess what they were looking for and they couldn't find it in Las Vegas?
Chinatown. We're looking for Chinatown. Going off Spring Mountain.
Yes, they were looking for authentic Chinese food, and we didn't have authentic Chinese food here in Las Vegas in the mid-90s. So a real estate developer from California, he saw this opportunity. He was originally from Taiwan, and he came to Las Vegas, and he purchased a piece of land in close proximity to the Las Vegas Strip. It's on Spring Mountain, and he opened up the Chinatown Plaza Mall in 1995 on Spring Mountain and Wynn Road, and start with one building in that area, and the rest of the buildings started to convert their industrial use to retail and restaurant use. So Spring Mountain Corridor used to be an industrial area because Wells Fargo still today owns a mine on Tenaya and Spring Mountain. Yes. So the Spring Mountain Road used to be the street where all of the trucks used to transport their minerals to I-15. So it used to be an industrial area. That's why you see a lot of the older buildings in Chinatown, the auto shops, the smaller warehouses in Chinatown. And because of the successful story of Chinatown Plaza, it drew a lot of tourists from the Strip. And at the same time, the Asian American population in Las Vegas was growing. And so fast forward 30 years later, now we have a very vibrant Chinatown in Las Vegas, serving both locals and tourists. And now we have a traffic problem.
Yes,
Yes,
we have
we
a
do.
big one. And parking.
Parking, yes, and there have been some public safety concern, especially during and post-pandemic time, and so there have been a lot of feedbacks from the community members reaching out to Clark County and Commissioner Justin Jones' office saying, hey, we really need some help and revitalization here in the Chinatown Spring Mountain area. And that's how Clark County started the Chinatown redevelopment project. And I was honored to be part of the team, to work with the community members to write the next chapter, the future. What's coming next in
I
Las
love
Vegas
that.
Chinatown.
Honestly,
Yes,
this is so
what's coming
powerful.
next.
Like, really?
Yes.
Yeah.
So I want to make a couple connections here because social determinants of health, or social drivers, we're starting to call them now. That's really the intersection. See what I did there? Intersection. The built environment between where people live, work, and play. But it addresses things like education, adequate and safe housing, employment opportunities, like you mentioned, public transportation. And Chinatown and the historic West Side are not that different.
Not at all.
So help us make that connection between the two.
Yes. So let me start off by talking about the social determinants of health. For this redevelopment plan, we looked in infrastructure upgrade, including traffic and public transit and sidewalks, and walkability. And we also look into housing, affordability, small business anti-displacement policies, and policies that promote tourism and economic development, and also how do we improve the public safety in the area. And all of these elements tie to this whole concept of public health and building healthy community here in Las Vegas. So what's unique about Chinatown and the historic West Side? So the original story of how Chinatowns were founded in the United States was because of racial discrimination. Back in the 1800s, 1850s or 1860s, when the first group of Chinese immigrants came to the United States and they started to build the transcontinental railroad. And some of the historical Chinatowns, the first one here in the U.S., founded in San Francisco. It was during the gold rush era. And then a decade later after that, the Chinese immigrants started to build the railroad throughout the United States. And some of the historical Chinatowns, whether it's in New York, in Pennsylvania, including the one that used to exist in Reno, but it's not there anymore. Those older Chinatowns were founded next to the railroad tracks. And because of racial discrimination, the Chinese American communities at the time were kind of being forced to live in certain pockets of the city and neighborhood, and they formed a community to support one another, to build the economic fabric of these small businesses supporting one another. And that's how the historical Chinatowns were formed back in the days. And you know, they were told you can only live here, not the other part of the city, and it's similar story to historic West Side and what happened in the past.
Oh my gosh, there's so much that we can get into.
Yeah.
Oh wow. But I really appreciate you sharing that history and the detail, because racial discrimination is a public health issue. Discrimination generally is a health issue, and until we really address that, we won't have health equity. So my last question for you before we run out of time here is, you co-created this plan with the community. Just share a little bit about, well, first of all, what is the Chinatown Redevelopment Project, but also how it was founded with the community?
Yes, when we kicked off the plan, I told the entire team that this needs to be a community-driven plan, and we need to involve the public since day one, not till the end of the plan where people only get a 2-minute public comment time at the public hearing and talk about their ideas. I want everyone to talk about their ideas since day one. So when we kicked off this redevelopment project, it's simply a neighborhood vision plan What are we going to do to improve the public safety, the small businesses, the housing situation, the parking situation, and continue promoting tourism. But at the same time, we have make sure that the food and is affordable for the locals as well.
Yes.
So how do we work with everyone in the neighborhood? So my first kickoff event was at the parking lot at Chinatown Plaza, the original building that started Chinatown, and we invited over 100 members to come, and that was last May of 2024. And since then, this is an 18-month planning process, and since last May, we have been having small roundtable discussions with residents, with small business owners, and with students who go to Clark High School and Spring Valley High School near the Chinatown area. And many of those students, they go to Chinatown to get a boba tea after school. So I want to make sure that the future vision, when we look out the next 20 to 30 years of what the next chapter of Las Vegas Chinatown looks like, I want to make sure that the youth is being involved in this discussion. And that's something that oftentimes when you have a big project like this, sometimes we forget to bring the youth to the table. And for this particular plan, I wanted to make sure that the youth is part of the conversation.
So for the listeners that are inspired to get involved, how can they get involved with your project and advocate for a healthier community?
Yes, please go visit our website at www.inspiringspringmountain.com, and you'll be able to see a description, a summary of the plan, what is it about, a timeline, a gallery page. I specifically requested to have that so you can see all of the photos from the community outreach events that we have done. We have set up booths.
And Minjia, I'm sorry to interrupt, but I just went to the page, and the first thing I see is a friend of mine that was in the Jameson Fellowship with me, and then another one, Commissioner Jones. I see you all over the place here. This gallery is fantastic. I'm sorry, I didn't mean to cut you off. Keep going.
So you can subscribe to our website, and you can also follow Clark County or District F's newsletter. Go to Clark County's website. You can subscribe to District F's newsletter. And please stay tuned as we are finishing drafting up the plan for my team, and we will publish the initial draft of the redevelopment plan, and then we will have, once again, public community meetings, community open house, and we get feedbacks from the community, and then we will revise and improve the plan before we submit it to the Board of Commissioners this fall for approval to adapt the plan.
Fantastic. Thank you so much for sharing this with us and being so generous with your time and information. We got to have you back on to talk a little more.
Yes, that's what I was thinking, a whole segment.
That's right. Absolutely. 100%. So, Ciara, let's close out.
All right. We got a couple of events. I'm going to make it quick. We have the Mental Health Monthly Mixer that is going to be at the Mariposa from 4 p.m. to 7 p.m. on May 28th. Mariposa is 2575 South Decatur Boulevard. You'll have the Executive Director, NAMI. You have CEO of Freedom Change Success, as well as the Deputy Executive Director at Solutions of Change. We have Sisters in Strength, SIS, which is an empowerment group for women living with HIV. This Saturday, May 31st at 12 p.m. at the center. It is free and open to all.
Awesome. Well, great events and lots happening in Vegas as always. So thank you for always keeping us in the know. This has been A Healthier Tomorrow. I'm Will Rucker.
I'm Ciara Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. We'll see you next time.
Bye, y'all.